So let me start with the more important one, which is the emergence of a new and more dangerous variant. The most common measures that we have read in the papers in response to the opening up of China is tests on travelers, COVID tests on travelers. But they do not help detect new variants of concern. It tells us if the travelers are infected with COVID-19 but does not identify the variant. New variants can emerge from anywhere in the world, not just China. So to detect new variants, we need an effective global surveillance system, where samples from infected persons all around the world are systemically collected, the viral genome sequenced, and then shared on a global platform. This is best done by countries for their own local cases, rather than relying solely on traveler surveillance because they can only provide a delayed snapshot. Fortunately, such systems exist today, and the most commonly used global COVID-19 genome sequencing platform is one run by a non-profit organization, and it's called GISAID, G-I-S-A-I-D. It stands for something, but they don't want to spell out anymore. It's just known as GISAID. The data is publicly accessible and protects the ownership rights of the source country. Today, GISAID hosts all shared genome sequences of 4 viral pathogens of global interest currently, namely COVID-19, influenza, Mpox, and then RSV. Singapore actively contributes to GISAID, which in turn works with many countries. GISAID has established a base in Singapore in collaboration with A*STAR, and MOH as GISAID has built up a very strong working relationship. Hence, when the major COVID-19 infection wave broke out in China, GISAID collaborated with the various Centers for Disease Controls, or CDCs, in major Chinese cities and provinces to obtain viral sequencing data. Today, Beijing, Shanghai, Guangzhou, Sichuan, Zhejiang, Jiangsu, Fujian, Inner Mongolia contribute up-to-date viral genome sequences to GISAID on a weekly basis. Just today, you can now find genome sequences from also the province of Anhui. It just fresh came out today. The data are analyzed and processed from their office in Singapore. There are still gaps in the data, so GISAID is working with the Chinese authorities to expand the data capture. So far, the data shows that the epidemic in China is driven by variants that are well known and have been circulating in other regions of the world. Dominating ones are BA 5.2, as well as BF7. Our local sequencing efforts on infected travelers from China further supports this. The majority, as I mentioned, BA 5.2 and BF7 strains, which have already been detected in Singapore and other countries for many months. Our assessment is also consistent with that of WHO's Technical Advisory Group on Virus Evolution, which just released its findings on 4th January 2023. This is a huge relief. What we fear and worry most, a new dangerous variant that evades vaccine protection coming out from China as the virus spread throughout their population, has not materialized yet. But we will continue to stay vigilant and plug ourselves deeply into the global surveillance system.